Hair loss, especially due to androgenetic alopecia, is a common concern affecting millions of men and women worldwide. In androgenetic alopecia, multiple alterations can occur in the activity of hair follicle cells. The hair cycle is disrupted, leading to shorter growth phases and finer, weaker hair. Eventually, hair becomes vellus-like, very thin, soft, barely visible hair, making reversal difficult without intervention. Hi, I'm Dr. Jyoti Gupta, consultant dermatologist based in New Delhi. I've helped numerous patients on their hair growth journey, and I'm excited to introduce a new innovation at our clinic to further enhance treatment result, which is Regenera Hair Therapy, also known as autologous micrografting treatment. Regenera Hair Therapy is a minimally invasive autologous treatment that uses a body's own regenerative capacity to combat hair thinning and loss. It specifically targets the androgenetic alopecia, a condition caused by hormonal and genetic factors that shrinks the hair follicle over time, offering patients a scientifically backed path to fuller and healthier hair. This innovative therapy utilizes micrografts derived from patients' own scalp tissue. These grafts contain progenitor cells or stem cells and growth factors that help stimulate the self-regeneration of hair follicles, reversing the miniaturization process and restoring the natural hair cycle. The process is very straightforward and typically completed in about 30 minutes. Firstly, we do the sample extraction. 3 tiny skin biopsies are taken from the occipital area of the scalp under local anesthesia, and this area is typically resistant to hair loss. Secondly, after taking the sample processing is done, in which the extracted samples are mechanically disaggregated in a specialized device, separating regenerative components like progenitor cells and growth factors. And lastly, injecting the processed solution into the thinning areas of the scalp where follicles are still active but they are thinning. What are the benefits of Regenera Hair Therapy? It can promote the thickening of the thinning hair and stimulate hair growth. It also encourages the dormant follicles to enter into the growth phase again. It also stops hair loss. It halts the progression of androgenetic alopecia by targeting it at the follicular level. It is minimally invasive. There is no surgery or stitches with minimal downtime. It is a one-time treatment. Unlike ongoing therapies, Regenera typically requires only a single session for noticeable improvement, though follow-up treatments will be required and advised. Proper diagnosis of androgenetic alopecia by a qualified doctor is essential. Ideal candidates are those who have miniaturizing follicles, that is, area where hair is thinning but not completely bald. Completely bald areas where follicles are no longer visible will not respond to this treatment. If you're noticing early signs of hair thinning, especially around the temples or crown, Regenera Hair Therapy could be a game changer. Early intervention is key. Once follicles are completely inactive, regenerative therapies may no longer be effective. Consult your dermatologist to see if you are a good candidate for this cutting-edge hair restoration technique.